Can Ozempic, or Wegovy, the drug that helped Elon Musk drop a ton of weight, help you live longer? I'll explain how this injectable diabetes and weight loss medication works, and if it's something to consider in your longevity journey. Welcome to House of Longevity. Now, let's get into it. You've probably heard the names Ozempic or Wegovy, or at least the jingle on TV commercials. Ozempic and Wegovy are actually two brand names of the same drug, Semaglutide. Ozempic is marketed for diabetes treatment, and Wegovy for weight loss. For the sake of simplicity, I'm going to refer to them both as Semaglutide for the rest of this video. So, how does it work? Semaglutide is injected once a week into the stomach, thigh, or buttocks. It's a GLP-1 receptor agonist, which means it mimics GLP-1, a hormone in the body that signals the brain that we're full and should stop eating. Semaglutide lowers fasting and postprandial, after a meal, blood glucose by stimulating insulin secretion in a glucose-dependent manner. This means that insulin is being released the same way it is for someone who doesn't have diabetes. It also slows the emptying of the stomach, so you stay fuller longer. This prevents blood sugar spikes. Among the side effects of semaglutide are gastrointestinal problems, nausea, diarrhea, and weight loss. Around 70 to 80% of people with diabetes are overweight or obese, so weight loss as a side effect is generally seen as a good thing. There's also a black box warning on semaglutide for a risk of thyroid C-cell tumors. A study published in early 2021 in the New England Journal of Medicine showed an average weight loss of 14.9% of body weight from baseline to week 68 of the trial, compared to a 2.9% weight loss for the placebo group. And once people learned about this, everyone who was anyone wanted semaglutide.
Look great. Everybody looks so great. When I look around this room, I can't help but wonder, is Ozempic right for me?
In June 2021, it was approved for use as a chronic weight loss drug. And in December 2022, it was approved for children ages 12 and up who are in the 95th percentile in terms of BMI for their age and sex. It's been talked about a lot on social media, and many famous people have either taken it or are rumored to have taken it, like Oprah Winfrey, Kim and Khloe Kardashian, Post Malone, and Mindy Kaling, to name just a few. There's been simultaneously wide approval for its use, and backlash against those who have taken it, and even backlash from those who took it and it worked for them.
Well, so my doctor, my anti-aging doctor, just hands it out to anybody, right? Oh. And obviously now I can't say her name, but I didn't even know I was on it. And I came back from a vacation and I injected myself with it. And I went to lunch with like a girlfriend a few days later, and she's like, I'm not really eating anything. I'm so nauseous. I'm on Ozempic. I'm nauseous too. And then I'm like, but I'm not on Ozempic. And she's like, are you sure? And I'm like, well, what is it? I go, I'm on semaglutide. And she goes, that's what it is. Ozempic. Oh, I'm not on it anymore. I stopped taking. That's too irresponsible. I'm an irresponsible drug user, but I'm not going to take a diabetic drug for like, I tried it.
Yeah.
And I'm not going to do that.
You're not going to do it anymore.
No, I don't. That's not for me. That's not.
So what's the problem? Before it was approved for use as a weight loss drug, doctors were prescribing it off-label to their non-diabetic patients, but at such a level that some people who really needed it couldn't get it for their diabetes treatment. All that aside, what happens to people who have reached their desired weight using the drug and stopped taking it? This study showed that an average of 2/3 of the weight lost was gained back within a year after they stopped taking it. It might be why it's referred to as a chronic weight loss medication, meaning you need to keep taking it. There's another side effect people are talking about known as Ozempic face, which is the loss of fat in the face, giving it a droopy or gaunt look. But is it a real thing?
So Ozempic is a diabetes medication, and it has the side effect of actual weight loss. And so a lot of people are now using this as an off-label treatment for weight loss, and people are losing a ton of weight with it, and they're finding that their face is changing. And one person even said that she doesn't recognize her face anymore. Now, we do know that with weight loss, you can also lose weight in your face, and I don't think that there's anything specific about Ozempic or Wegovy that changes your face that normally aging wouldn't do. And that is individual. Everybody's face changes differently if they lose weight. With more rapid weight loss, you may find that the skin doesn't have the time to really kind of adjust to it and to kind of jump back to what it used to be. But the problem with this is everybody is different. You know, the older you are, the less you take care of your skin. All these are factors that can really change how somebody's face looks with weight loss.
So, like he said, that's a normal side effect of extreme or rapid weight loss for almost any reason. And for someone suffering from severe obesity, this may be the least of their concerns. Finally, can it help you live longer? The simple answer is yes, if you suffer from type 2 diabetes and or are obese and have struggled for years to lose a substantial amount of weight, this can extend your life. Here's why. Comparatively, this drug is a safe, non-invasive alternative to bariatric surgery, like a gastric bypass, sleeve gastrectomy, duodenal switch, and adjustable gastric banding. Those surgeries come with risks and require extreme lifestyle changes that most people can't maintain, so they should only be a last resort. But the positive effects of weight loss shouldn't be downplayed, since obesity is a major risk factor for cardiovascular disease, hypertension, diabetes, and stroke. If you reduce your chance of getting any of those conditions, you will live longer. 2 studies showed that treatment with semaglutide in people with type 2 diabetes demonstrated consistent reductions in major adverse cardiovascular events compared with a placebo, regardless of baseline blood sugar or kidney function. I'll link the study below. But if you are overweight and struggle with bad habits like binge eating or eating when you're bored, or you're on a seafood diet, you see food and you have to eat it, then semaglutide is not for you. Exercise and self-discipline are for you. Maybe a shock collar that a loved one can trigger when you try to buy junk food.
Can I please get a large Coke? Oh, a large fries. No! Stop! Thank you.
All jokes aside, my conclusion is that semaglutide is a great innovative drug for diabetes and weight loss, and by extension, longevity. But it's definitely not for everyone. I'm not a doctor, so do your own further research and talk to a medical professional if you think you might be a good candidate for either Ozempic or Wegovy. I'll leave a bunch of links in the description for the full videos from which I showed clips, and from the studies and articles I quoted. Don't forget to give this video a thumbs up and hit subscribe. Send me a super thanks if you'd like to support this channel further. Thanks for watching, and see you soon.